Greetings. My name is Mike Levis, and I'm an instructor with the Mountain Hood Ski Patrol Avalanche Program. The topic of this presentation is emergency care for the avalanche victim. In the following, we will discuss special considerations for care of avalanche victims. We assume you've all been through OEC and are proficient in patient assessments, spinal motion restriction techniques, management of hypothermia, and general procedures for treatment of traumatic injuries. In the following, we will start with a discussion of the phases of avalanche death. Avalanche death occurs as the end point of a progression of events. If we can interrupt this progression in our rescue efforts, we can prevent the endpoint, death, from occurring. We will then touch upon the three H's: hypoxia, hypercapnia, and hypothermia. We'll then wrap up with a discussion of the principles of care for avalanche victims. So let's discuss what happens to the avalanche victim. When the avalanche first occurs, the victim is tumbled violently, bounced off rocks, strained through trees, and put through the avalanche blender. If the victim's skis or snowboards do not release, there will be very violent twisting of the victim's extremities. Snow will get into all of the victim's clothes and any open orifice, for example, mouth and nose. When the snow stops sliding and the victim comes to rest, hypothermia will start to set in. We call this phase, up until the victim comes to rest, as the trauma phase. Recall that approximately 25% of victims do not survive past this stage. Those that do will quite likely be suffering from blunt force trauma injuries. For those victims that survive the trauma phase, overall mortality rate is about 25% and is strongly impacted by burial depth, burial time, airway patency, and presence of an air pocket. Mortality for full burial is 50%, but rises to 90% if the victim is found and extracted within 20 minutes. When discussing the phases of avalanche death, we refer to the survival phase, the asphyxia phase, and the latent phase. As you can see from this graph, the survival phase is from beginning of burial to about 20 minutes. The asphyxia phase is from 20 minutes to about 40 minutes, and the latency phase is from 40 minutes to 100 minutes. For those who want to dig deeper into this, see the reference article listed at the bottom of this slide. There's been a lot of work done in avalanche emergency care in Europe, and this paper is an excellent review of much of the latest information. The survival phase is called this because a victim, if found and extricated during this phase, has a very high survival probability, assuming they did not suffer lethal traumatic injury during the trauma phase. The asphyxia phase is when most buried victims usually die. As the slide comes to a stop, the victim's airway is often blocked by snow, and the victim's face is surrounded by very dense, low porosity snow. If the victim's airway is not completely obstructed, the victim's breath will freeze around the victim's mouth and nose. The warm exhaled air melts the snow around the victim's face, which quickly refreezes to an ice mask that is relatively impermeable to air. The result of this is asphyxia. The victim cannot get sufficient oxygen, and hypercapnia, the buildup of CO2 in the victim's blood, that leads to unconsciousness and death. The third phase is the latent phase. Survival in this phase is only possible if the victim's airway is patent and the victim has some sort of air pocket or emergency device that provides access to fresh air, for example, an avalon. However, hypothermia is a critical issue for victims that survive long enough to reach this stage. These victims will typically be found with very low core temperatures and need to be handled very gently during extrication. The triad of hypoxia, hypercapnia, and hypothermia is known as the Triple H syndrome. It is the cause of death of most of the victims in the latency phase. Hypoxia, or lack of oxygen, and hypercapnia, or buildup of CO2, lead to unconsciousness. Hypothermia eventually leads to cardiac arrest and death. This slide outlines some of the considerations for treatment of avalanche victims upon extrication. As always, check ABCs, in particular whether there is a patent airway, clear away any snow from the airway, and clear away any ice mask. Check for breathing and pulse. Victims that are not breathing and pulseless need CPR. Note, however, that if a victim has been buried more than 60 minutes, or if core temperature is less than 30 degrees, then hypothermia is a big issue and CPR may be deferred. Administer O2, heated if possible, if available. For severely hypothermic patients, handle very gently and monitor for afterdrop. If the patient is not conscious or at least AO by 3, then this is an automatic backboard case. This patient has been severely injured and needs to get to the hospital as quickly as possible. This slide shows a flowchart developed by the European Resuscitation Council for avalanche burial victims. I provide this as a reference as well as a link to the full European standard. That brings us to the end of this module. Thanks for your time.